Hi, my name is Kelly Clyer, and today I will be talking about assessing and improving community health in areas of concentrated disadvantage. This was a project done with the Hamilton County Health Department. Today I will be going over background, methods, results, a discussion on this topic, and finally my conclusion and recommendations, and then a future assessment for the future of this project. Managing population health and improving the processes by which we do this is extremely important. In this study, I worked with the Hamilton County Health Department to determine how to improve health equity in the geographic areas they need to focus on. Health equity is driven by social, economic, and environmental factors. It is heavily influenced by geographic location because socioeconomic factors impact the practice or neglect of health-promoting behaviors. In 2015, the Hamilton County Health Department composed a report using U.S. Census data to map the levels of various demographic factors in 49 communities. The indicators included variables such as population, poverty, unemployment, racial segregation, mortality, and life expectancies. 5 census variables were used to calculate this concentrated disadvantage for each census tract. The report successfully related CD and demographic factors to geographic locations within the county, but did not consider behavioral health factors. I had 3 objectives for this study. First, I wanted to expand on the health department's previous report by examining differences in substance use and nutritional habits based on census tract locations within the county. The second objective of the study is to allow the health department to understand whether or not they would be able to analyze this data on their own instead of hiring a data analytics company to do it for them. Finally, I wanted to assess the main reason why people in urban counties frequently do not go see their doctor for yearly appointments and create a proposal that could be suggested from the Hamilton County Health Department to local hospitals and physician practice groups. The Hamilton County Public Health Department educates, serves, and protects its community to promote a healthier future. The health department serves the following communities in Hamilton County. It serves those who live outside the cities of Cincinnati, Norwood, and Springdale. A regression analysis was done on the MPI data for each factor being studied. Next, a chi-squared analysis was run using statistical package for the social science, SPSS, in order to test the association between CDI, z-score, and the MPI for each variable studied. Then, GIS map overlays were created using the CD variable and the CD score. These maps were created using GIS software. In order to complete the next objective, 2 firms' financial data were obtained and used to calculate the AP flow time, inventory time, AR flow time, and cash-to-cash flow time, and finally the return on assets. Next, I researched why so many people do not visit their doctor regularly. I did a process map and calculated the utilization, the cost of employee time per patient, and then created a proposal that the health department could recommend to hospitals and physician practices. These next slides show the chi-squared analysis and GIS map overlay for each factor studied. The market potential to drink any beer in 1 week was greater in areas of high concentrated disadvantage, with the chi-squared being 8.703 and p equals 0.003. The market potential to smoke greater than 7 packs of cigarettes in a week is greater in areas of high concentrated disadvantage, with the chi-squared being 11.704. For other tobacco purchases, the market potential to smoke cigarettes in a week is greater in areas of low concentrated disadvantage. The chi-squared value is 25.023. The market potential to purchase fresh fruits each month was greater in areas of high concentrated disadvantage, with the chi-squared value being 7.658. You can see the map overlay for this is very similar to the previous ones shown for both tobacco and alcohol usage, with the high concentrated disadvantage areas being highlighted as the same areas that have poor nutritional habits. Next, I did a regression analysis. As concentrated disadvantage increases, the market potential index for drinking any beer in the last week or drinking any alcoholic beverage in the last 6 months decreases. Next, as CD increases, the MPI for smoking cigarettes in the last week increases. However, these results are not significant due to the R-squared value. Next, as CD increases, the MPI for using fresh fruits and vegetables in the last month decreases. Next, I did a performance measurement on 2 different companies, the Oracle Corporation and the Hewlett-Packard Enterprise Corporation, to determine whether or not either one of these companies would be good to help the Hamilton County Health Department analyze their data, or if they could possibly do it themselves. And if so, if they do need help with one of these 2 companies, which one would be best? Finally, in order to complete my third objective, I looked at how the process could be improved for patient care. Many patients do not schedule yearly physicals because of the time that it takes to get in to see the physician and how long the actual appointment itself takes. According to a recent study at Harvard Medical School, it looks like patients on average spend 121 minutes between scheduling their appointment, waiting, and actually going to the visit. This is far too long for these patients to be waiting for a small issue or to even just see their doctor about a smoking cessation or alcohol cessation program. As you could see with previous results, smoking, alcohol, and eating unhealthy in concentrated disadvantaged areas is a major issue in Hamilton County. Therefore, if we can reduce the amount of time people are waiting to see a physician, we may be able to get more people into the doctor's office and prevent diseases in our community. I did a process improvement map of the actual process at a hospital, going from making the appointment to driving to the hospital, going to the registrar, waiting in the waiting room, and then finally either seeing a nurse or a doctor. I then looked at the percentage of total wait time based on the average number of minutes that it takes for each of those steps to occur, and then looked at it as a percentage of the total hour. Once this was complete, I then created a proposal for this to see exactly how much money could be saved, how much time could be saved if we did reduce the time it took to complete some of those different stages. By following this proposal, a hospital could save $21.91 per patient and could also save the patient 30 minutes of wait time throughout the beginning stages of making their appointment all the way through the end of the appointment when they're seeing the nurse or physician. It is the job of the Hamilton County Health Department to determine where areas of concentrated disadvantage overlap with poor lifestyle and nutrition habits. Once they know these, they must determine how to help those people lead healthier lives and propose a solution to hospitals and physician practices. Concentrated disadvantage can be used as a guide to examine geographic health inequities for smoking and nutritional habits. Instead of investing in the purchase of MPI data, organizations and health departments can focus on high CD areas easily identified using census data in order to intervene in smoking cessation and nutrition improvement. After researching the long wait times patients are experiencing and how unsatisfied they are with making appointments, it is clear that the health department needs to find a way to help those in our community who do not have an extra 121 minutes to wait to see a doctor. I recommend the proposal that was previously outlined. This saves 30 minutes for patients overall, and it also saves money for the hospital. This would increase patient satisfaction, and hopefully more people who are living in areas of high concentrated disadvantage would be able to go to their doctor for help with smoking and alcohol cessation, as well as help with diseases due to poor diet. Based on the types of measurement and rates of drinking, published studies have found conflicting results. Therefore, more analysis must be done on the results obtained relating to alcohol usage. More analysis could also be done on reasons for people not scheduling appointments to see their physician. More proposal ideas should also be made for the Hamilton County Health Department to propose ideas to other hospitals and health organizations. Thank you for listening.